Ladies and gentlemen, board members, we are ready to begin today's briefing meeting. The time for starting is 2:05. We are going to go ahead and begin. Mr. Toiber, I know, is on his way. Ms. Kuckel will be here shortly, is here and will be out shortly. So we're going to go ahead and begin so we can have our presentations because it's going to be quite full. Today, under Executive Services, we're going to be reviewing the codes of conduct for both primary, secondary, and adult education, our student progression plan, and the exceptional student educational policies and procedures, as well as the plan for student assignment. Under Academic Services, we will be having a look at for the upcoming school year and allocations regarding mental health. And then we will have public comment at the end for those of you who have comments, may have comments regarding the presentations. Okay. So all said and done, we're ready to begin. Dr. Bohatch and Mr. Mangan and Dr. Creel, you're there, you've got everything up and going, and you organize yourselves in the best order you can. And hopefully internet will cooperate.
All right. Well, actually, we did a pre-briefing on our code of conduct and at our last opportunity, and just really wanted to come back before you today to see if there are any questions.
I don't have a question. I have a comment. Brian, I don't think you were here. I mean, you were physically present, but you weren't at the thing for the last briefing, were you?
Yes, ma'am.
Oh, you were?
I didn't have much to say.
Okay, well, I failed to mention to you how impressed I was during your tour with Senator Rubio. You were the consummate host, shall I say. The level of knowledge that you exhibited was really great, and I think that you really, really impressed him. So thank you again for what you do out there. Has nothing to do with student code of conduct, but it's the first public opportunity I've had to say that to you.
Okay. Anyone else, any comments or questions or concerns? Ms. Fisher.
Yes. No concerns. Okay, I just wanted to compliment the team on the mission and the updating of the devices responsibility form and the programs that are helping children clarification. So on page, I think it's 30, this is what happens when you go over it too soon and then you forget. Mm-hmm. Okay. Okay. Well, anyway, I think the pages, it says 30 or 107, and then it says bullying and harassment and prevention programs. The delivery, how is that, I know that you're undergoing some changes, so how is that going to be handled district-wide as far as the delivery of the programs? Because I know there's been a lot of discrepancy, you know, who was using what, and I know we had a big investment in Second Step over the last few years, but I think a lot of those kits that were sent out to schools were not necessarily able to be utilized. And I know that now we have an online situation for middle school, which is great. So I was just wondering, you know, how that's going to be monitored.
Part of what we are doing is, and Lori Brooks will speak to you in just a few moments as a part of our mental health update, is identifying programs that will be utilized throughout the district. We are not at a place that we are mandating certain things, but we are providing guidance on which programs that we believe we will see the greatest return on our investment, or there is even a program that doesn't cost but is seeing great results. And so Lori will talk to that in just a few moments.
Okay.
However, I do want to mention again about the fact that we are adding a focus in academic services that takes Chuck Bradley, who has served as our ESE director, who is very integral in behavioral specialist and how we work with our ESE students, recognizing that those same strategies will work for all students. And so he is going to be working with all of our schools to help them to develop plans so that they have those consistent expectations outlined at their school, so that there are processes not necessarily around award and an award and a bucks kind of a procedure, but
Right.
rather what are the expectations? How are we outlining that for our students? How are we using positive motivation? And here's some of the positive things that can happen in a school so that we are preventing that negative behavior, really resulting in how do we take a proactive approach to this as opposed to having to respond through the code of conduct with consequential measures. We want to have the measures outlined, but we would rather have in place a proactive approach to how we are addressing the situations with our students and helping our teachers really outline that. We've been training yesterday and then today on how we are looking at the ABCs, that attendance, behavior, and classroom success. And we recognize that in order to have classroom success, we've got to attend to the attendance and we've got to attend to the behaviors in order to be able to focus on the increased student achievement. And so that really is the whole method behind having Chuck move into that positive prevention role. And it's tying in so nicely with what we are doing around the social and emotional needs and the mental health piece that we are being asked to put together as a plan as a result of the tragedies that have occurred and what our state is asking us to do. But we really are already embracing that social and emotional needs and how we are educating the whole child throughout this process.
Thank you.
So I thank you for that, and I'm really encouraged by that. And in looking this over, I also was wondering, like, at each school, who's responsible for that? Because is there a behavior specialist or a behavior coach at each school? I don't think so, but there may be.
There is not a behavior specialist at each school.
Right.
There are connectors from an MTSS process. There
Yes.
are connectors there, and the MTSS process has a part of all of the aspects of the attendance, the behavior, and the classroom success because they all play into this. And so that would probably be our primary connector at the school as we work through this, as well as those intervention specialists that we'll be working with at each one of the schools.
So considering the percentage of kids who are ESE or the percentage of kids who get involved in discipline, which is a small percentage of our total student population, then how does this fit in for the general population and everyone else, this prevention and early intervention thing? Because I think it's important. I'm a prevention person, and so I'm really excited about what I've seen in here, and I'm just wondering how that's going to be.
I think the piece that you just said is the percentage of students that are identified with behavioral needs and the percentage of students that truly are repeat offenders from a disciplinary aspect. We believe that we can engage more students through a positive prevention piece, really by accentuating and encouraging students that are doing the right thing. So oftentimes the students that are getting attention because of negative behaviors are the ones that seem to cause the administrators and cause the teachers to devote so much of their time to them. We believe that this will flip that tide and allow the students that are doing the right things to be recognized for their positive pieces. That means that we're working, Chuck will be working with schools on recognition programs that are on an ongoing basis so that we have the opportunity, not just at the end of the school year, but throughout the school year to recognize students that are doing the right things. And that can encourage other students that may not be on that track yet to join that and be a part of that.
Right, absolutely. And I think that the schools that have been employing that have had a better level of success. So I'm just concerned about consistency across the district. But I really want to compliment all of you on the work that has been done on this and the improvements. And I like this whole positive prevention page. I think that's important for parents to look at because it gives them some ideas of things they can do on the home front.
So
And I
can-
really, yeah, and I just really wanted to, have you kind of explain that because I think it's so important and I think it's going to have a positive effect on our
allowing
students.
us to speak to that a little further. I would like to kind of speak to you about what you just brought up about the consistency piece, because there are multiple layers to this. What we're talking about is kind of at a high-level view, but what we have in place are processes that we are outlining in regards to our connecting principals with the 4 or 5 schools that they're working with, and how we're having conversations around the attendance, behavior, and classroom success. So there will be opportunities to monitor at that level. There will be opportunities as we move out throughout the year to have these conversations with our data force meetings, because the positive prevention is a direct result of the data that we gather from discipline infractions. And so as we continue to have conversations around on a quarterly basis at the extreme length, we will be able to be talking about what is taking place in schools and hear those things on an ongoing basis. And then we also have our executive directors for school development that will be going into the schools. Our school improvement planning process will include this as one of our strategies that is required to have as a part of the school improvement plan. And so we will be having, as an ongoing monitoring piece, questions about how this is being implemented within their schools.
Awesome. Thank you so much.
you. Anyone else? Okay, thank you so much. We really appreciate it. Coming up, we have Ms. Brooks and Ms. Houchin coming to share with us about the Student Pupil Progression Plan. And we have Dr. Creel still at the helm. Very good to have you at the helm.
Thank you.
Good afternoon, and thank you for having us back to brief the Student Progression Plan and District Course Catalog. Our presentation will look the same as last time, but I added a slide based on a couple more updates, actually. Since the May 22nd pre-briefing, the state had added the PSAT as a possible test to earn a comparative score or concordance score for the Algebra 1 EOC. So in the 11th hour, before that State Board of Education rule passed, in draft form, we had placed it into the Student Progression Plan, and all of those scores passed the vote. However, they added the PSAT as an additional option, and we added that to this final version. And also, based on your feedback, there was a suggestion that we reference the actual concordant and comparative score chart in the Student Progression Plan that is on page 31. So everywhere there was verbiage in the document that referenced comparative or concordant scores, we referenced the table on page 31.
Thank you.
Thank you for the suggestion. In addition, I believe it was Miss Morgan that caught, there was a physics course that said Florida International Baccalaureate Physics and then International Baccalaureate Physics. And actually what we were missing was the word pre. Florida has its own version of the pre-IB courses that it has defined for the International Baccalaureate program. Florida creates pre-IB for the 9th and 10th grade students with its own curriculum to prepare them for the full IB course in each subject as juniors and seniors. So we added the word pre, so thank you for noticing that. It was an omission on our part, and now we think we have a perfect document. So those are all of our updates.
Okay. Board members?
Okay. Yes. Okay. So looking at the student progression plan and knowing that we, in 2017, passed a comprehensive health education policy, I was wondering, again, how that's being implemented this coming year. I know we had a half a semester of health is mandatory at 6th grade only, right? Okay. And so what about the Comprehensive Health Education Policy 3.071 that says that we will teach health through K through 12?
I believe we have the health standards embedded in some of our core courses, and they also have electives that many of our schools offer in 7th and 8th grade as part of a requirement, like in lieu of PE. We have students that take it that way, but in our core courses, we put health standards where they align with the topics.
Okay, but we have a policy that says, and I quote, "Comprehensive health education is required instruction in grades K through 12. It shall be taught efficiently and faithfully using the courses of study and adopted standards and employing approved methods of instruction. It shall address the concepts required by the Florida statute. It shall be designed to ensure that students meet the health education standards. Beginning the 2017-18 school year, all schools will implement district-approved, evidence-based, age-appropriate, and comprehensive health education academic plans." And I've seen those plans, which are really comprehensive. So, my concern is a couple of things. I think kids need to be healthy in order to be ready to learn. I also think that we've had a lot of success with our employee wellness program, but I really feel like we need to be spending time and energy on teaching kids healthy habits from the get-go, early on. And for instance, I know that our health educators have written the curriculum. I also know that our health services department has provided an opportunity through family health centers for vision and dental screening. Now, I know that many children who could not read, they were discovered to find out that the reason they couldn't read was because they couldn't see. So, and I think this is part of what we're talking about as comprehensive health, along with what we'll probably hear later on about the mental health part. So I'm just thinking that I don't hear that health is being taught even through the core subjects, and it is in some schools by some teachers, yes, but again, the district consistency and the opportunity for kids to develop those habits concerns me. And I also want to be sure that we're compliant with the statutes and the policy, and that we are doing more than one semester in 6th grade, because, that's a one-shot deal, and I don't think it really covers what the intention is in the Florida standards. So I was just looking for more explanation about that.
We did, to speak to that, we did give flexibility on some of the course options because we don't have enough certified health teachers in the district. And so I can tell you that for middle school especially, the schools that tended to offer it, a year long, more than a semester, and the others worked it in under a different course code, but at least a semester, and it was at multiple grade levels and then at high school as well. But I agree, to do a heavier lift, we're going to have to address the certification issues.
In addition to that, one of the things that we can look at is our health standards and see if we can go back and look at our science instructional guides and curriculum maps and show the alignment with the health standards so that we are being very purposeful about inputting the health standards into the content areas, so that very similar to what we do in elementary school with social studies, to make sure that we provide social studies reading prompts. Although our teachers aren't necessarily teaching social studies every day in elementary school, we are making sure that we are providing reading activities that are embedded within the reading instruction. And so one of the things that we can do is to go back and work to connect those health standards into the specific content curriculum maps, so that our teachers can see that very purposeful alignment with that, in addition to what's already in place with our 6th grade health courses, and in addition to the HOPE classes that are taught in high school.
Thank you.
Yeah.
Anyone else? Thank you very much. Excuse me. Mr. Chuck Bradley. And soon to be retired, Miss Jackie Turner. When is your last day?
Next Wednesday.
Sorry to see you go.
Thank you.
She will be.
Very bittersweet.
Yeah, I understand.
She will be greatly missed. So thank you for the opportunity to bring to you today the Special Programs and Procedures Manual for Exceptional Student Education. We have a basic PowerPoint for you today, and just basically want to present the document. Of course, we have provided that document to you. This year is a little different in the way the document was developed and created. There's a new document. Typically, the Department of Education is also coming into the 21st century slowly with this document. And so this year there was a new website where the document was provided. We had to input information into the website. And so typically you have seen the strike through and underline for the additions and deletions. That was not available this year because of this new format. So that's why the document looks like a complete rewrite. This is also, this year, the entire document was up for review. Typically in the past, only sections have been required to be updated according to changes in legislation. This year it was a full open rewrite, and so with the new format and with the new document, that's why it does look the way it does. So this is just an example of how the document showed up for us and how it works. So the state did put in the statutory or board rule guidance at the top, and then asked for the district to provide the response and how they were going to implement that. So as you can see here, and I believe Jackie worked on this particular section herself, so Jackie put in the response after that state prompt.
Our manual is divided into 5 different parts. Is this on? So part 1 covers our general policies and procedures, and these are the things that we are required to do by state statute, by Florida statute, and by state board rules. We are required to have this document. If we don't have this document and don't bring it forward for your approval, we lose our funding. So it's very, very important in that aspect. It's also very important because it gives us our compliance information. When someone calls up with a compliance question, we can reference this manual and find the answer. So part 1 are our general procedures, and it's the assurances to parents that they will have their rights, their students will have their rights, and that we will provide a free, appropriate public education for their child. Part 2 covers all of the policies and the procedures for our students with disabilities for all 18 eligibility categories. It lists the evaluations required, what the eligibility criteria is, and it also includes the related services. It also talks about our requirements in relation to individual education plans, disciplines for students with disabilities, and their participation in the state and district assessments. Part 3 covers gifted. Yes, gifted is part of exceptional student education. Part 3 talks about the eligibility criteria to be determined a child who is eligible for gifted services, and it also discusses educational plans and the requirements for our educational plans for students who are gifted.
Part 4 covers policies and procedures for parentally placed private school students with disabilities. As you may be well aware, IDEA covers all students within Lee County, regardless of their placement in private or public education. So this section covers how we do provide those services in terms of our proportionate share to those private schools or to those students placed in those private schools. It also governs the McKay Scholarship and Gardner Scholarship rules for application. The remainder of the document includes, which is kind of the bulk of the document, includes appendices, and appendices A and B provide the general policies and procedures, and then the unique philosophical, curricular, or instructional considerations here in Lee County, so how we apply IDEA here locally.
Appendix C has always been one of our big challenges, and the state is requiring us to examine the percentage of students eligible for gifted programs from underrepresented student groups. These would be our minority students, our students who are ELL. Our percentage of students in gifted is woefully low in gifted. So this appendix details our plan for trying to identify additional students from those demographic groups who would be eligible for gifted. We've done some piloting with a program this year and had some very interesting results from that.
Appendix D, district policies and regarding the allowable use or prohibition of physical restraint and seclusion. We do not practice seclusion in our district. We do practice restraint of students, and we make this particular section governs the type of training that we must provide, the type of monitoring that we must provide, and the reporting that we must provide.
We have no lab schools in our district, so we didn't need to do anything with Appendix E. And Appendix F includes our best practices in inclusive education, document the results from our assessment that we've done as a district.
And so at this time, are there any questions?
I have clarification and question with regard to, in the past, I have worked with 1 or 2 private schools where an administrator saw that they were not meeting the needs of the student. Ironically, they would always identify it, though, just prior to the end of the 3-year evaluation date, which would require the student and family to go through the whole process again. I don't know if my frustration, I believe, is with the state, but I need clarification from you, because many of these students go into a private school. Maybe it's not with a McKay scholarship. Maybe it's with another one of the from the corporate tax credit scholarships, and the student and family goes in there, and the idea and the thought is, oh well, we can go into this nice smaller setting, very homey feel school, and my student's going to do better. And depending on who the headmaster happens to be at the time, sometimes they get ignored. And so my concern is that we have a couple of times been able to catch a student right before that 3-year evaluation date ended, and we're able to help them make connection with you, Mr. Bradley, and so that they could be served and put back within our district. That is a problem within the state with not requiring any type of reporting out insofar as student progress. Am I correct?
You are correct, particularly in certain private schools that do not adhere to any kind of connection with our state curriculum. We do have problems within the state, and it's not just here in Lee County, this is statewide, in that we oftentimes do see students that do not have adequate reporting as to their progress, and it makes it difficult to determine then placement here or services that are needed.
And the reason why I want to bring that out is these students then come back within our district, and many times they have regressed in where they were prior to leaving, and it requires a great deal of expenditure of time and monies to try to bring them back up to where they need to be. And I'm just wanted to share this and bring it out for public. Our community needs to have that awareness that many times, with the best intentions, our students are not best served by making those choices. So I hope that we are able to move forward and make some changes within our state so that if money follows a student to a school, there needs to be a reporting out of where that student happens to be. There needs to be a way to monitor, just like we are required to monitor the progress of our students as well. So that is I'm sharing that because I believe that is something that quite possibly we may want to bring forward to our legislator rather loudly to address.
Well, thank you. And if I can be any assistance in helping with that, I'd be more than happy to help.
You will be called. Thank you.
Thank you.
Anyone else have thoughts or concerns? Okay. Thank you very much for your work and diligence. It takes a team. And next, Dr. Creel, Ms. Ralph, and Mr. Moore will be discussing and reviewing the plan for student assignment. Yes, updates.
Good afternoon, board members. It's a pleasure to join Dr. Creel and Ms. Ralph up here at the dais. Seems like Dr. Creel is the only permanent part of this set, and we're just kind of moving rotation scenery. But I've been asked to join today because I'm a bit of a link to the past. This is a bit of a baton hand switch as we move student assignment or shift student assignment over to its rightful place in academic services, but also to mention that operations will always be a strategic partner in that plan. But I do want to review with you all the process in which the student assignment plan is reviewed annually. We do have a professional learning community that's comprised of district-level administrators, teachers, school-level administrators, folks in our departments here at the district office who look at that plan and look for opportunities to improve it. So it is a living, breathing document that we look to improve and look for efficiencies and look for equity and fairness in on an annual basis. Also in that process, any recommendations that came out of that PLC were brought to EDAC, DAC, and finally to our school board for approval. Now the 2018-19 plan has already been approved by you. That was back in November 2017. And we're looking to bring forward an amendment to that plan. But I first want to bring you back to 2015-16. And I was a planning director at that time, and we brought forward a recommendation from that professional learning community to update that plan to put some controls on high school transfers, high school student transfers in zone. And part of that was targeted at reducing mobility, which we all understand has a detrimental effect on not only the student, but the school and the teachers as well. So our intent today is to bring forward a proposal to amend the 2018-19 plan to include a caveat for middle school, just like we did for the high schools. And we have data to suggest that that was a positive change in our plan and it resulted in a reduction in mobility. And that's something I believe Ms. Ralph and Dr. Creel would like to discuss with you a little further. So without ado, I'll pass the mic to them.
Good afternoon, board members. When we talk about the mobility of our students, our middle school principals and Dr. Creel have brought it forward that this continues to be a problem at the middle school level. We're looking at all of our secondary students. When we talk about the mobility rate for 16-17 school year, of our 20 schools that have grades 6 through 8 students, we had at least 8 of those schools with over 20% mobility, which is huge. And that's students moving around. That mobility, based on House Bill 7069, that's when we put our early warning system in effect. And that's one of the key indicators that we look at for students: mobility, attendance, and of course their grade progression. Those students that are moving around are getting lost in the shuffle. They sometimes act out. They have more suspensions, more truancy, and the attendance. And we've already heard Dr. Creel talk about the ABCs. All of those things are things that we want to look at. When we also look at our students in grades 6, 7, and 8, those are our students that are beginning the process for getting their credits at the high school level for some of those students. This transition of making a movement to our student assignment plan for this upcoming school year, that's been effectively endorsed by both DAC and EDAC. We were able to present that to them at the May meeting. So they had questions. We answered those questions. Some of those questions were long-range questions, of which we want to be able to answer in the future. But Lee County is very different from other school systems in Florida. No one else has a student assignment plan like ours, so it's hard to compare us to those Big Ten districts, and that was a question that came out in DAC. So with our recommendation that we bring to you today for your input is that for this upcoming school year, we would look at our middle school students would follow the high school students. They would be after the 15th day of school. They would only be allowed to make a transfer at the end of the semester. Of course, there are waivers that can be submitted for those hardships. Dr. Creel?
No, I think that when we look at the research and we look at Hattie's effect, we recognize that mobility is an integral part of making sure that we are taking away the negative factors that impact education. And this became a recommendation as a direct result of what our middle schools were looking at in trying to support the academic success of students and making sure that our students had the ability to have those instructional moments last throughout a semester, oftentimes at a semester that it concludes with a class, or at least gets to a place that we can make a transition. And we just feel like that this will continue to help increase our teacher effectiveness and our student progressions. And we also feel like that with this, we will have a greater understanding of the teacher needs as far as where our student numbers, if you've got teachers that are moving, if you have students that are moving from school to school and we're not necessarily able to move those teachers to follow those students, we feel like that this can give a more equitable access to students with class pupil-teacher ratios as well.
Dr. Coco?
So confirming, these are students that are moving internally within the district. Okay, secondly, what do we do to assist them then if they've moved from one end of the county to the other in transportation?
That would be when we would look at the waiver request and make those moves for those students. We understand that those situations occur, but what we're really looking at is students that become unhappy with their setting and they want to just switch schools. We want to look at those problems that are occurring with those students to help identify those students as to what needs they have.
So they'll be required to stay in the school, and so you're wanting to make accommodations or support for different needs, and where does that come into play? Then who works from that angle?
So we want to talk, right now, our graduation coordinator, you've heard Dr. Atkins in several of his talks that he's given during the month of May. He's talked about the great success that we're having in graduation. Shelley Taylor is our graduation coordinator. She, along with Lori Brooks, who's over our high school counselors, they'll work together to identify those problems. Shelley is actually reaching out to some of those students and actually talking to them about their concerns. And oftentimes, the feedback from the student is, I just wanted somebody to care about me.
So that will automatically kick in when you come across a student that wants to move schools, and the basic reason is something around the conflict in the classroom or with other students, and a team will form, like an IEP team. How will that take place, and how do we know that it will automatically kick in when there are those kinds of issues? I mean, do we have a description for and a process for how that takes place?
What you'll see is that coming forward as a direct result of our mental health work, as our psychologists and our social workers and our counselors begin to really form a team. And I'm going back to the same conversation that Ms. Fisher started us off with around the work with our social and emotional aspects, and Chuck pulling into that. So what we already see are these people are forming a real vital team, and we see that those people will come in contact together. We don't want to get to what will be presented to you as a threat assessment type of environment where we're reviewing students. We have that in place, but we want to make sure that we are meeting the needs of children. This is not really about children that are in a struggling situation. Oftentimes, this is just about children who want to move just because their best friend is somewhere different and they just want to move. And that really is what this is addressing. If there are children that are in crisis, if there are children that need to have waivers considered and hardships considered, then that certainly will take place. But this is about just moving for moving's sake. Keep that consistency in place. Okay.
Mr. Toiber.
How does this impact the family that through choice, they got their fifth choice, they don't want to be there, so they have to start going to the school that they're chosen to, but they've got their target and they're trying to work on the opening of their choice that they want, but it gets beyond that 15 days. Are they now locked in that school, or is that process, because it's been instigated, will that circumvent?
So the 15-day process that you're talking about, that's something that we're trying to address right now. We realize that there's opportunities to improve our student assignment system. We want to look at all those opportunities, and we'll definitely look at the middle school students first.
So, anyone?
Didn't answer the question.
So I get, may I follow up? So I guess the question would be, after the 15 days is over with, do they then automatically lose their place on the waiting list for the school that they would prefer to go to?
So let me go back to Mr. Toiber. I think I heard you say you didn't feel like I answered your question. I'm going to use my whole 4 weeks of experience in student assignment right now, but we're looking at those middle school students first. We don't have very much movement at the high school level. We don't even have very many waiver requests to begin with. Our middle school students, we have a few, but not that many. Most of our waiver requests are at the elementary level. So we want to start looking right now, prior to school starting, of who has submitted a waiver for the middle school level. We want to try to address those. Pick up the phone, make phone calls. We've actually started doing that with some of our ESE students yesterday and today. Talk to the parents, see what their real concern is, and see what we can do to fix that problem. So hopefully we can get to the point of we don't have as many waiver requests, but there's always going to be that need of that person moving homes, moving jobs, and they have to relocate. Those are the ones that we really want to identify.
I do want to let you know that when we looked at our data, go ahead.
I was just going to say, I think to just try to directly answer the question, the question is, you know, yes, they lose that opportunity after the 15 days. That's the direct answer to the question. The other thing, though, I need you to understand is that the changes that we're trying to make in this department as moving forward is that twofold. One is up front, you're working to better make that match in the very beginning. Part of the problems that you get into with some of the situations that you're occurring, like we had one that occurred here at a board table where somebody wound up at Island Coast, and had they had a little bit better customer service in terms of, you really don't have an opportunity to get into this school because it's further away, it's an art school, it's jam-packed, but you have a school right down the road from you that you've got listed as your second choice. If you put it as your first choice, you're going to get in there. So if we have that type of customer service in the very beginning, I think, first of all, that will help eliminate the fifth choice issue. The second thing is that better customer service up front also helps with the waiver process. One of the frustrations that we often encounter is that parents sometimes don't have those waivers fully understand. They don't understand a good reason for a waiver. They just write one, and then we're going back and at it again and again until we get it right. Instead of all that, if we're providing that good customer service up front and the parent's able to discuss, here's my work situation or my home situation, so that they can make that better connection up front, that eliminates, I think, more of those requests moving forward. So yes, we are trying to get away from having these waiting lists go on. So yes, you lose that. However, you're avoiding a lot of some of this unnecessary inefficiency in the system by providing better support up front in terms of those matches during the selection process, and in terms of how we do and conduct waivers.
In addition to that, some of our data tells us that 90% of our middle school students receive their first choice of school, as well as when we pulled the waiver request, we had less than 20 waiver requests at the end of this year. So that's
Ms. Matricka.
And in terms of the customer service end of it at the beginning, one of the criticisms I've heard is that the high schools and the middle schools sort of bash each other during open house. Instead of it being a positive experience, it's one where choose me because they stink kind of thing. And so that makes us a district of schools instead of a school district.
Exactly.
And I'd like to see a push toward being more positive during those open houses. I didn't see it during the high school open house process myself, although admittedly I think I only went to one official open house. But during the middle school open house process this year, I did see some of that. So just a suggestion in terms of upfront better customer service.
Great.
Thank you.
Okay. Anyone else? Okay, thank you.
As Ms. Ralph leaves the area here, I do want to let you know that we will be moving forward, transitioning from calling it student assignment to a student engagement center as
wonderful.
We engage our students into our learning process.
Like that.
Yeah.
I do.
And thank you for joining us again, Ms. Brooks.
Thank you for having me.
And we look forward to hear the plans for the coming year.
Thank you for the opportunity to speak with you today regarding Senate Bill 7026 and our district mental health plan, and most specifically regarding the mental health allocation. This is a large topic to cover in 10 to 15 minutes, so I hope that I can cover it all. We have a large initiative to put into place in time for the July board meeting, and the Department of Education provided us technical assistance last Friday, and they're also providing meetings through the Department of Education with planning sessions that are multidisciplinary for districts to go and develop their full plans. So we are slated to go on June 20th and 21st. as a team of 7 individuals that cover all of the related areas that really team together for the mental health and well-being of our students. So I'll cover that a little bit through this plan. An evidence-based mental health plan is one that covers 3 tiers of services, and you'll see this in the document you received as part of your agenda today. And thank you. The first tier is Tier 1, and that's universal services to all students. So this would be our prevention efforts, our social emotional learning that you've heard about today. So already Lee County was out in front of a lot of these services and improving the ways that we educate the brain without leaving the heart behind, because we need to pay attention to all student development. And so our Tier 1 services are really provided by our school-based mental health professionals. These would be our degreed and certified school counselors, our social workers, our school psychologists, and our school nurses. Together, those 4 positions truly are our student services mental health professionals. And so we have social emotional learning, we do needs assessments, a lot of prevention, trauma-sensitive practices. Some of our schools are receiving training on how to be trauma-sensitive schools, so really a lot of school culture as well. In addition, for Tier 1, you would also look at universal screenings for connectedness, similar to the Gallup student poll, where they gauge students' connection to others in the school, to meaningful adults. What is their engagement? We hear a lot about engagement. In fact, our 2 days of district learning are about student engagement and teacher engagement. So this is all part of Tier 1. In Tier 2, we have targeted services. Now, these would be services still within the schoolhouse by our school-based mental health professionals, and these services are for students that need a little bit more. This may be some of our students that are exhibiting behavioral challenges, and not all behavioral challenges are indicative of a mental health challenge, but we need to start really, I would say, drill that down and try to figure out, do we have a child that needs help with behavior? And the social emotional learning that we've infused into our school-based learning is connecting but not fully connecting. So this would be maybe a student that's going to go into a small group setting with the school counselor for social skills development for that second layer or second tier of assistance. And then we would also have targeted problem solving with Tier 2. Can we serve the needs of this child at the school level? Now, some of these kids may be in the MTSS problem-solving process. However, some of these students may present with a challenge that is not necessarily related to behavior and academic performance just yet. It may be that they've experienced trauma, and we need to look at this in a Tier 2 manner before it impacts the academics and/or the behavior. And then we move into Tier 3. And in Tier 3, that's where we really need to look carefully for the student at the individual problem solving, and then also look at referrals for potentially for mental health assessment and services. I mentioned earlier that we had a district team, and I wanted to cover with you the depth and breadth of the expertise that's on that team. So we have our district leads for school counseling services, health services, psychological services, MTSS, positive prevention, graduation, and attendance and social work. So we're covering all of the school-based professional areas that would team together as a school-based mental health team to look at the unique needs of each child, while at a district we're also collaborating in that way. Now, while we develop this district plan, it really must be said that each school is different, and you as board members, our superintendent, everybody that visits schools, you know every school is different, and yet in many ways they're the same. So each school will have to consider their context and answer some of the parts to this plan, and other pieces will be standardized. So today what I'm presenting to you is really what can we standardize, because as a team we looked at district-wide, looking at this mental health allocation especially, where we have funds to support 90% of this allocation has to go to the direct services to students. How can we ensure that what we put in place district-wide is what is implemented in the schools? And so the recommendations are as follows. The first item that really came to light at the immediate onset from each of the team members is the Success Academy redesign. Now, while we're looking at serving the needs of all students, and we feel confident this plan will, Success Academy needed to be looked at a little differently because the one final piece missing from that redesign was the direct access to mental health services for those students in that building. And so that was a quick win. That went right up on the whiteboard, that we would like to provide Success Academy with an on-site licensed mental health counselor through Salus Care. This will be a contract with them. It will be a 12-month contract because while the licensed clinical mental health counselor will be on campus during vacations, including holiday vacation and summer, they'll house at the Salus Care campus, and students will continue to receive those services. So just because we all go on vacation doesn't mean their mental health counseling will cease. And so they will continue that until they're complete with their treatment plan. In addition, we are going to hire a full-time school psychologist for the Success Academy because the school psychologists, through their role, they have in their skill set the ability to look at a student's overall needs and look at their behavior and be very specific and evidence-based through their unique degree set to also supplement the school counselor, the social worker, the mental health piece, and assist teachers with strategies for that student from a whole child approach. In addition, having a full-time school psychologist at Success Academy will assist students that transition there that may be in the evaluation process, that when they transition, they would end up moving from a school with a psychologist who then needs to follow them there and find them there and get all of that done. This would allow that transition to happen and the Success Academy school psychologist to take that over. We're also working on an agreement. We're hoping with Golisano, Mr. Bradley and I are in discussions with them for the Royal Palm Exceptional Center. They've had a contract for medication management. Med management is a very necessary piece, but partnered with mental health counseling, you really can help a child get through that whole process with managing through some assistance of medication and working through the counseling piece. So that's another layer that we are looking to contract out. Now let's talk about students in general in all of our Lee County schools. And I know this is a lot, and I apologize that it's a lot of information at once. The first, beyond Success Academy and Royal Palm and really looking at their unique needs, we wanted to determine how we could serve all students in all schools that may be in need of a Tier 3 approach. So in a perfect situation where school districts and the Department of Education, they do understand and they readily admit we have not had the funding, nor do we have the funding based on the budget this year to truly do the Tier 1 services the way they need to be done. We're doing and we're going to continue doing the best we can, and even with a renewed focus on that. When you look at any tiered system, your Tier 1 should be effective for more than 80% of your students. The prevention, the early intervention should be serving 80% or greater of your student population. And by the time you reach Tier 3, you should have 3% of your students in Tier 3 or less. We're operating in Tier 3 at a much larger number across the United States. This is not unique to Lee County or Florida, as we all know. But right now, because we have a larger number of students in higher layer or levels of need because of the early intervention and prevention maybe not being as effective as it should, we're looking to serve a larger number of students. So for all of our students, we've worked with Salus Care, and we're developing an MOU agreement that any student that may be in need of a mental health assessment, parents have the opportunity to choose, because it is a health care decision. They can choose to go with whichever provider they would like to. But if they would like to go to Salus Care, because they are our community behavior center, we have an MOU that says if a referral is done by the school district, and because the parent would like us to do that, we will have a turnaround time of 2 weeks from the time the referral is received to the time that the first appointment occurs for the intake. And that's a better turnaround time than we've been able to achieve in the past. So this would be a direct connection to Salus Care if the family would like to engage with them. We will certainly help them navigate wherever they would like to go, but this MOU will define what Salus Care has offered to us and committed to us and what we've committed to them. It also commits us to following up directly with Salus Care and with the family to make sure if their feet have not landed there with that referral, that we as a school district work with that family to ask what other barriers are you encountering, how can we help you, and that leads us into our staffing, because we also, yes.
Before you move on, how are they paid? Are they paid on a per-student basis, or is it an annual contract? How's that?
So yearly.
Annual contract for Success Academy. And then the MOU is just a definition of agreements, and they will work through our students that are on Medicaid and bill Medicaid directly to recoup those costs, private insurance, and then sliding fee scale if the family is uninsured. However, with our uninsured family, this is where embedding additional district staff will help to navigate families through Florida Kid Care and removing some of those barriers they might be encountering if they're uninsured and haven't found their way through that system yet.
So do you see a budgeting or financial disincentive for the school or the district to refer students based on this MOU? Is it going to cost us money, is my point? Would there be a financial reason for us to err on the side of not sending a child that direction?
No.
Okay.
I'm unable to see I can't see where it would. What we are struggling with, and I talked with Salus Care CEO again today, is when and at what point, and I think this is where all the districts struggle with this, at what point are we going to have a challenge where Salus Care may not be able to serve the need, and we're going to stay in direct conversation to try and make those determinations. One of the statements on our plan when it deals with expenditures will state, and I've noticed this, other counties are saying that funds may be shifted from one category to the other because we're all trying to figure out exactly how this might roll out in our district. And we don't want to overburden our community behavioral health center either. But right now with the direct billing through Medicaid and then other insurance from families that are insured, and then also Florida Kid Care, they think we're going to be okay. But it's uncharted territory.
Isn't there a new hospital opening in Estero on 41 that will be the only other mental health assessment program or facility in Lee County?
I'm unaware of one. I know we have a small center of David Lawrence. We have Golisano Children's Hospital, and then Salus Care are kind of our larger. But I'll look into that.
Well, I guess my point in bringing it up is if we get to capacity with Salus Care, then if that place is built, we could pursue that as well, because that might be a good location.
Thank you.
And then Salus Care just opened the new Children's Care Center, which is exclusively for kids at the Ortiz campus. So that's another number of people that they'll be able to service.
Sorry, I didn't mean to interrupt you.
Oh, that's okay. And that is true, Ms. Fisher. That came up in our conversation again today, that they have this wonderful children's mental health center. They call it they have a very nice name for it. They have music playing. It's very relaxing for families to walk into on the Ortiz campus. However, our families will be able to engage at any of the 3 campuses that they have between Fort Myers and Cape Coral. But the Children's Center is really beautiful.
It is.
Okay, so as we looked at this, the other facet that we really felt the district could improve based on this allocation and this assistance is the wraparound services for families. Because as a previous school counselor, I could refer families to access to mental health. I could follow up with them. However, I was not the staff member that could necessarily go make a home visit and say to them, let's sit down and really talk about some of the barriers that you might be encountering. I had to rely on having them come back into the school or talk by phone. So our school social workers then become another critical layer in this process. And so what we are aiming to do with this allocation is to allow our district to staff a full-time social worker in every high school, which we currently do not have. We have part-time, and we have, as you know, itinerants where they're sharing schools. And so now we'll have a full-time social worker at every high school. Our other aim is to have a social worker at least 4 days a week at every middle school. So the average age of mental health challenges emerging is starting at age 12. So ages 12 to 18 is really where we see youth struggle with mental challenges, mental health challenges. This would place a social worker full-time at every high school, 4 days a week, maybe 5 at every middle school. This would allow for wraparound services to the family, but also if they engage in mental health counseling, back to the schoolhouse to help us support the child according to their therapy plan. And so we can start engaging directly with providers. And this could be an agency that the parent chooses. We would obviously have to have parental releases, but now we've got a navigator to the system and back to us. So that's why we would improve our increase our number of social workers. We are also seeking to add board-certified behavior analysts for non-ESE students. Now, BCBAs can be very expensive, and we know we have some challenges to mitigate in this area. And so, but we think that our behavior analysts are critical because many of our principals say, I have problem behaviors in my school, and we have behavior analysts and behavior specialists for students with disabilities. However, we don't have that layer of expertise for our non-ESE students. So that was another layer that we're looking to fill for our schools. These would be professionals that would coach and train school-based staff to build capacity so they would know how to deal with students that are exhibiting problem behaviors. That would allow schools to also delineate between, do we have a child that needs to learn replacement behaviors, or do we have possibly a student with a mental health challenge? So there's another layer. Before I move into threat assessment, do you have any questions in general about some of the services to all students?
I do. Dr. Kuckel?
Have we reached out either in the planning stages or in the delivery stages to private child psychiatrists, pediatric psychiatrists in the area to be involved in this with their feedback and then maybe some volunteer efforts along the way?
In an effort to engage various providers, you'll see under additional initiatives, we are going to develop a youth mental health cabinet, and that will include school-based, district-based, but also a lot of our medical professionals in the field to provide feedback for us so we can identify as we implement where are our gaps, how else can we serve families, and we would like to get everyone engaged in that process. So that's where I think we're going to engage with some of our smaller psychiatrists and psychologists, because certainly parents are selecting them, and they may not be able to serve capacity-wise, but we are going to encourage families to choose whomever they would feel most comfortable with. And then Salus Care is that option if they just have no idea where they should go or what to do. We have that as a larger option. But we want to encourage families to make their own personal choices. And we welcome, and if you have any suggestions of private providers to participate, we would welcome that so we know who to invite.
Actually, I do have one. And so I'll get that to you. But I think from an advisory capacity, we definitely need to have a cross-section of our private providers.
Absolutely.
As in an advisory.
Yes. Salus Care, by the way, is not our only provider, and I anticipate that we should be developing MOUs to define some of the sharing that's required in this bill. And so Mr. Dodig and I have been in conversations, and we'll be talking about developing MOUs so that we've got that information sharing, because FERPA and HIPAA are definitely dancing very closely to each other in this legislation. So it would protect us and protect families, and some families are going to choose not to sign that release, and we understand that. We just want to do the best we can in explaining the supports we can provide to their child if we have some of that information.
I do have one question. I don't see an allotment for social workers at the elementary level. Mm-hmm. And while I do understand that many mental health issues begin to fully manifest themselves at the middle school age, mm-hmm. there are many precursors that are happening at elementary that if they were caught, it would help prevention. Ounce of prevention. So that's my one question that came out, that as I was looking through this, I don't see an allotment for our elementary level.
You're correct. We're hoping, and we're not hoping, we think that there is going to be a trickle-down effect as we add these social workers at high school and middle school, that we'll actually have some additional days that push down into elementary social workers. And we also have to remember, too, that we do have school counselors at the elementary level. And at the elementary level, we really tend to focus a lot with our school counselors on prevention and the early intervention. However, it's not in the plan right now, but as we look more closely at our allocation spending, I think we may be able to shift a little bit more. We are we're painting in broad strokes right now. We know we can afford this. However, we may be able to add additional increments to impact elementary school, and it's definitely not off the table, because you're right, that prevention is at K-12 level, but the early intervention in elementary school can be so critical.
So this is a question, I guess, that would go then to the superintendent and to the whole team. Dr. Creel's team, the superintendent. Are there conversations with our elementary principals with regard to how they use their school counselors? Because that is where we're having, there's been a big disconnect that our school counselors have not been able to fully address and counsel the students as appropriately, because they're locked into some other administrative aspects. So what is being done to help address that?
I'm so glad you asked that. I've mentioned about the way that this team is really working together. They have been outlining what are the duties and the responsibilities of our school counselors, what are the duties and responsibilities for psychologists, social workers, and so forth. They are creating a Venn diagram that shows how these work in tandem and what overlaps and how all that works to support. So I can't say enough wonderful things about this team that is coming together. This team was already talking about this when I met them in November. I think they were just chomping at the bit, waiting to have the opportunity to really focus on social and emotional aspects. But I have to say that since the events at Parkland and beyond, that this team has really ramped up their efforts for how they can clearly communicate, how we can set those expectations for principals, and how we can give the guidance for how these individuals can be utilized at the school. And just to kind of go back to your question, Ms. Pam, about the social workers, we've got the fact that we do have social workers that are not specifically assigned just to one specific elementary school currently, but we do have social workers that are working with our elementary, middle, and high school now that are currently a part of our already allocations available. So I didn't want us to walk away and not feel like that our elementary schools had access to a social worker.
Exactly, and I think part of that is they are typically assigned to schools that they target. They don't necessarily go from one elementary to another, but they have targeted schools they work with, correct?
Yes, ma'am.
That's what everyone needs to hear.
Yes, and there is coverage for every elementary school. But you are correct, they're itinerantly assigned.
Okay.
And our goal, at least starting out, is for high school to have full-time, middle school at least 4 days, and we will look at elementary again.
Thank you.
I have a few more items, and I know we're probably a little bit over time, and I apologize. I do want to talk with you about the threat assessment protocol, because that's part of Senate Bill 7026. And as you've seen through the last months, this legislation has legs in so many different camps. We have code of conduct statements. We have Rick Parfit and the school hardening, and then threat assessment protocol, and then that marries over into the mental health piece with our interdisciplinary team. So with the threat assessment protocol and the training that the district team will receive and then deploy to school-based threat assessment teams, we also have a statement in that threat assessment teaming protocol that a student could be referred for a mental health assessment that may be a threat to himself or potentially to others or herself. And with that, we felt that we needed a faster turnaround time. So that one will also be a contract with Salus Care. And again, families can choose whomever they would like to. If it comes out of a threat assessment team that the team is recommending that a parent take their child for a mental health assessment, we want to provide them with a place they can go and get immediate service. And so with a contract with Salus Care, they can guarantee us, and I called them again today, I said, I'm briefing the board, I want to hear the word guarantee one more time. They can guarantee us a 48-hour maximum turnaround time. And in many cases, it would be 24 to 48. The parent, as soon as they arrive, they would have a clinician ready to do that assessment. And so the reason that's a contract is we needed to ensure that we do provide them an extra clinician at each of their 3 intake centers to serve the needs of our walk-in clients as we do follow that threat assessment protocol, if it results in that type of response. And then, of course, the sharing back of that information to the school with the parent release. In your document, I listed a few Tier 1 services. This is by no means comprehensive. I wanted to focus today a lot on the actual allocation and the district-wide push of services to students in that 3rd tier of need. Our comprehensive plan that will come to you for board approval in July will be the full tiered approach after our work session with the Department of Education, and that will include more of what we do at Tier 1 and then Tier 2, including these services at Tier 3. And then I also included some additional initiatives. We're applying for the SAMHSA Mental Health Awareness Training Grant. We're hitting submit on that tomorrow, and that is for mental health first aid. The Department of Education is developing their light version of training, which is mandatory and annual for all school staff, and it will be a mental health awareness training. And their lighter version will be, they assure us it will be a comprehensive training. However, if it's annual and it's required of all staff, it's not going to be a deep dive into mental health awareness. So if we are awarded this grant, we would be able to provide a one-day training that would be more of that expertise. And schools can engage in that, and we'll do multiple training sessions throughout the year, and this grant would pay for subs or Saturday trainings.
Wonderful.
So the word of the day is agile. We're going to have to be very agile as we develop a plan that we feel is already really well developed, but we have a lot more layers to put into it so that we bring you a comprehensive plan in July. And then it will change as we move through year 1 and we obtain feedback from schools and from parents and students and all of our stakeholders. This will be an annual update and an annual review, and we welcome feedback now and all throughout this journey.
Board members?
I just want to say thank you.
Yes.
And I get to work with a wonderful team of administrators. The talent around that table and the collaboration has been phenomenal. It's been a wonderful opportunity for us to really work for the good of our children. Thank you, and I apologize that I went over.
Thank you.
Biggest thing going on right now.
This is important. Okay, it's now time for public comment. I don't see anyone. Oh, we do have one public comment. Mr. Martin, would you please read the rules?
School board policy provides the opportunity at this point in the meeting to address the board concerning any matter on the briefing meeting agenda. The subject of comment is limited to the items on the agenda. Time allowed per speaker is 3 minutes.
Gwen Gittens. And in looking at the Student Code of Conduct, I had a couple of questions. Actually, there were 3, and I will give a copy to the Secretary. The first one had to do on page 4, where you have increased family and community engagement, and you crossed out the part about understanding. And my comment to that is, for the sake of community confidence, maybe explaining that a little more by saying through enhanced understanding might help them, because just engagement, I know you're trying to shorten it probably, but it's a little just kind of vague. It's engagement could be anything. So my suggestion is somehow including the enhanced understanding. On page 23, the psychologist services, there is not a mention of how the students are identified. So if, for example, if a teacher can recommend that a student have these services, so that's just something you may want to look at. It goes into the process that they will use once a student is identified, but how are they identified? And on page 29, under the bully policy, I talked to a couple of people about this, and there's one item, number 4, that says use humor. And I have a little bit of a concern about that, because in most situations a bully is someone that has low self-esteem anyway, and if humor is used, they may take it to mean that you're laughing at them rather than just the situation. So I don't know if that's a part of a program that you have, and that's why it was put in there, but I would just make a suggestion that you look at that using humor, and especially at the different grade levels, because the younger grades would not understand how to tactfully use that process. Okay?
Okay, board member comments. Ms. Fisher.
Yes, thank you. Today I have, in addition to thanking our staff for their wonderful presentations today and all the work that's being done, and I know it's a lot, I wanted to bring up for the clarification for some points for the listening audience regarding the superintendent's contract. So one was, and I've talked with Mr. Martin about this, and he's prepared to comment on these so that there is a clear understanding. The actual total value of the contract, some people have contacted me and said $300 and something thousand. So I said, well, that's not exactly accurate. And when I spoke to Mr. Martin, he was able to explain. And then, would you mind helping me with this now? Thank you.
Well, the full cost of the contract that's listed in the agenda item is the full cost for compensation for that position, but of course that includes compensation that is common to every employee of the school district, such as retirement, Social Security contribution, health and life insurance contribution by the school board that goes for each employee. If you take out those standard benefits that are provided to every employee, the total compensation under the contract is $237,818.
Which is still less than many of our neighboring counties and other districts of similar size and demographics. And then the other part was the absence of mention of duties. Somebody said to me, well, that's his compensation package. What's he going to do for it? So I put in here and in my note to you that maybe there should be some mention of duties as prescribed in his job description, so that that kind of clarifies that and makes a clear understanding for people who are looking at it. And those were my two. So
I'm happy to address that if the board desires. Certainly, the contract as it exists right now, what's being proposed does not include a reference to the job description. If the board is more comfortable with that reference being added, we can certainly do that before this evening. I don't think it's necessary. The wording of the contract when it addresses duties is that the superintendent will faithfully perform his duties and obligations in that position. That's the position of superintendent. The duties and obligations are established by the job description the board has adopted, so they certainly are implied as part of the obligation under the contract.
thank you. And that was it. That's all I have.
Okay. Ms. Giovanelli?
I have none.
No, thank you.
Okay. Mr. Teuber? I have none.
Oh, my gosh. Okay.
You, Kathleen.
For you. Wanted to mention a couple of partnerships that I thought were really interesting. First of all, Dr. Creel and I met with the Horizon Council Business Issues Subcommittee and discovered to our surprise, is she still here? Oh yeah, there she is. That there seems to be in Lee County no common place where everybody is focused on career and tech ed. And one of the things that we're going to work on is exploring that within the district with some agencies outside. But it was a good meeting. I think it exposed a lot of gaps and misunderstandings. So I think the group is interested in proceeding to try to pull something more constructive and educational for the business community together. The other one I went to, Melissa went also, was the Search graduation. Now, I knew nothing about Search.
Yeah.
And that's
At Golisano.
At Golisano, yeah. It's a one-year
Yes, that's
transition
wonderful.
program for young adults with intellectual and developmental disabilities. And I just wanted to mention it again because I like talking about partnerships where people in the community are working with us to provide support for our students, and these are kids who have either graduated or in their last year of high school, and trying to give them the skill set, basic skill set they need, and some basic experiences so that they can in fact go out and participate in the broader community. Let's see. Oh, got a letter from Florida Department of Education today regarding our complaint, or not our complaint, a complaint submitted by someone else about the construction budget and costs for building Bonita Springs High School in the Lee County School District. And their response is, upon review and analysis of new information, they had asked us for a little bit of additional information after our initial response. The OIG has determined that the new information answered the key concern for which we requested additional information by the Lee County School District. Therefore, the OIG considers this matter closed and will take no further action. Okay.
Amen.
Done. I have two good of the orders. And Dr. Atkins, you're going to talk about the meeting with OPAGA?
Yes, I will.
Okay, all right. Then those are my comments.
Okay, and I just have, Dr. Kuckel, did you? Community engagement the other day when I was at the Lehigh Chamber of Commerce, I found two pieces that were valuable. There is a pharmacist within the Lehigh community who wants to give any of our students multivitamins for free. And talk about a powerful piece that is very needed for the students in the East Zone. And Healthy Harvest Farms in the East has a foundation that will provide buses for our students to go out there on field trips. Many times our students are not able to go out to some field trips because of the cost. And so that is available. So Dr. Creel, I will be sharing that information to you so you can disseminate it. But the more we get together with our community members, the more possibilities we come up with of ways that we can interconnect. And it's a powerful thing.
Powerful.
Dr. Atkins.
As was mentioned, we did meet last Thursday with the folks from Evergreen Solutions, and they are the group that have been contracted to to conduct the audit on behalf of OPAGA. So it was a very productive meeting. We have 3 folks that will be joining us, Dr. Mary Chamber, Dr. Linda Riccio, and Betty Russell. And I think that, we have a very, very tight timeline that which we have to submit items to their Dropbox. And Greg Blurton is our project lead, and he is already has our team actively engaged in providing them information. So, like I said, it was a productive meeting, very positive meeting. I really enjoyed spending time with them, and I think that they understand the time crunch, and so they're going to be reviewing some of the documents that we previously had, such as our financial audit, our operational efficiency audit, and then also some of the information that we will receive back from Gibson Consulting, which we've got some preliminary information in already. So again, very productive. And then Greg has the team working. They have a team meeting scheduled weekly, and I know that there's meetings ongoing even during the week so that they can stay on top of this and get them all the materials they need in a timely manner. Those are all my comments.
Okay. Dr. Martin.
No report today, thank you.
Okay. At that point, we are adjourned, and we will meet.
Good of the order.
Oh, forgot good of the order. I am so sorry. Please, please. Good of the order. Ms. Patrica.
In my various travelings around the district to talk about the half-penny sales tax, I have frequently said to audiences that I would at some point like to have a discussion with the board about making a commitment to making sure that the first revenue that comes from, the first dollars that come from that revenue are devoted to safety and security upgrades in our schools. And I've been telling audiences that I will ask you guys if we can get some consensus surrounding that. So I just feel like we're at a point with safety and security. Every time we talk about hardening our schools, you bring up softening our schools. Today we talked about softening our schools, so now I'm going to talk about hardening them. And so is that something that we can agree on? Is that something that I could say with confidence to audiences instead of saying, this is something I'm going to ask them about? Now I'm asking you.
Are we talking a certain dollar amount and within a period of time?
I think we have to, I think what I would like to be able to ask the superintendent to do is make safety and security expenditures the top priority when that revenue comes in. So, I mean, they'll obviously have to present a plan as to what that looks like, but I think that for me, that has to be our top, priority.
Dr. Atkins?
I understand the request. I mean, I would want to make sure that we're not, we don't put ourselves into a box. I would be more than happy to. I totally understand that is the intent of this board, and I think moving forward, we would be submitting to you a plan in terms of what those first dollars what they would be spent on. One of the things that we've been talking about is some of the items. We've done a number of different things here recently. We have updated our project list. We had one draft. I asked for another draft. I've asked for another draft, so we've had them resubmit, and I'm pretty confident with the one we have right now that actually changes the project list allocation and has a heavy weight to safety and security to the tune of about $60,400,000 for our project list. Now, having said that, this summer, 2 of the main projects, partially some of them that are on this list, which include the security technology at the front and also the red key system, are 2 of our top priorities that we're going to be already jumping on top of using existing dollars. So, we'll be working our way down through this list. Some of these items are actually on here over the course of the summer. So, but again, having said that, I just want to make sure that I understand the request. And I also, though, want to make sure that we have the flexibility that we need to also channel resources to building schools and toward doing maintenance of schools, all of which will be ongoing at the same time we're receiving these dollars. That's all.
Mr. Toiber?
And then also for the good of the order, and we're talking about
Hold on. Let's finish that part before we go to the next one. Anyone else have a comment? I have a thought, Mr. Martin.
Well, just for clarification, that revised project list is a matter that will have to come to the school board for approval.
Okay. I appreciate fully the intent of that. I do believe the security and hardening is critical. At the same time, part of that security and hardening is the building of the new section at Lehigh Senior High. Being out in those portables is not a safe and secure piece for them. So maybe we could, I would like to, I would be probably more amenable to looking at a percentage part of that money that comes in would be dedicated to this as a flow of working through it. And I'm not sure how that would look, but to do it 100%, I'm cautious about.
Not suggesting 100%.
So that's what yeah.
So if it's the board's pleasure, I mean, if in consideration of what the request is, the board member, if I could have some time to consult with staff, and then I'll bring forward a recommendation that I think would be in the spirit of what that request is for your consideration as a board.
Does that work for you?
Yeah, that's great.
Sounds good.
I guess my feeling is that we need to wait until we see the list. I think we should be telling the public that once we see the list, we'll have an opportunity as a board to weigh in on the priorities that are demonstrated in the list. It's really nebulous to me to just say, are we saying the first dime that comes in the door goes to security, the first annual payment goes to security? What is security? I think we need to have something harder to look at. I feel very comfortable going out to the community and saying, it's my priority, and when that list comes to the board, I will make certain that the discussion responds to any concerns that I have with respect to the priorities that are reflected on the list. But that's where I'm coming from.
We need to see something.
I agree with Kathleen. Safety is important regardless. So we just have to keep it at the forefront. So I agree. So I think we have to see what that looks like it entails. So.
Ms. Fisher?
Yes, and that was what I was going to say also. Safety and security has always been a priority in the school district, and I think that safety and security could look like different things, so I wouldn't want us to be in a box, and I would want to see what the superintendent and staff bring forward as a need. I know you mentioned Lehigh. I've been out to Riverdale, and
yes.
Part of what needs to be done there would definitely impact the safety and security. So I think a lot of the building and maintenance needs are inherent in that, maintaining that good safety and security for all of our students and staff. So I would want to be wait and see.
Okay.
Get
that
the
conversation ended?
No, finish on that, because my understanding is, I mean, when I'm speaking, the list is what we're being held accountable to, so that's the list. And so the priority of that list can, if it's safety and security is at the top, that's going to, I mean, that list is what's going to dictate where we put the money. Isn't that correct, Dr. Atkins?
Well, yes, and we have safety and security at the top, but just to give you an idea, like, it says continue to keep our students safe is at the top, lockdown view panels, access control, surveillance with integrated technology, et cetera, et cetera. Then the next thing would be meeting needs of increasing population, elementary school, East Zone, middle school. So my point is some of these projects are going to be going on simultaneously.
Mm-hmm. So that list isn't necessarily the order in which things will occur.
And may I ask a question? Isn't there already additional funding for safety and security that has come to us recently?
Yes, yes,
okay.
Correct.
Okay. Mr. Toiber.
And I don't know if it's to go to order, if I just in my comments, but we had the discussion, I don't know if we've had it as a group, but I've had discussion out in the public that, one of our large voting bases is Cape Coral. And they've just now changed their school population, their school management now to the city of Cape Coral. And they are in the situation that they need money like we need money, and the proportionate share to figure out, you know, if we as a community wants to give capital, because the legislature's failed them as much as they failed us in the sense that they've got some of the charter money, but they don't have, you know, they're caught in between the two paradigms. So it's something, is this board willing to discuss to give them a share of that sales tax, to have them be a proponent of this sales tax and drive that message in Cape Coral for the betterment of the entire Lee County community? And I just want to throw that out there for the board, if that's something we want to consider.
Ms. Patrica?
I thought we saw numbers on that where they were receiving a hugely disproportionate number of PICO dollars. Weren't they? Didn't we see numbers on the funding that they're getting for capital? And it was,
I think, yeah, most of you did see numbers, and the idea there was we were collecting numbers, meeting individually with board members and sharing you those numbers, and at some point we would be making a recommendation related to what he's talking about. Is this something that the board wants to bring forward for discussion? There's Dr. McCullers has done quite a bit of work on this, and there's a lot of little idiosyncrasies that you have to consider. There are some other more difficult questions in terms of if we were to do something like this, what would be the role of the city of Cape Coral in helping us with some of our initiatives, and how would we be able to hold them to that? I can put that on our individual board agendas. We can talk about it, and then I'll get with the chair and we can make a discussion in terms of when and if to bring that discussion forward for public consideration.
Mr. Martin?
Just clarification, the use of sales tax dollars for that purpose is something that other school districts had done to support capital projects for some of their charter schools, and the manner in which they have done that in order to comply with the statute is to list specific projects for those charter schools, because under the sales tax statute, the allotment is not a pro rata. It's not a matter of this amount per student. And when you bring the referendum to the voters, of course, there is a project list, and the commitment there is to fund those projects.
Exactly.
So in sharing any of those dollars with charter schools, it could not just be a pro rata share based upon the number of students they serve, but must be an identified project which fits within the criteria of the statute for which those funds would be used.
And Dr. Atkins, didn't Dr. McCullers mention something about if there were some kind of a partnership with Cape Coral that might implicate other locations like FSW and?
Yes, he did.
It's because, yeah.
FSW, and I believe he also mentioned the Island School.
Island School, yeah.
Ms. Giovanelli?
Well, so, Steve, just clarify for me, are you saying that we collaborate with Cape Coral and give them some of the,
I'm saying now defer to Dr. Atkins to come to us individually, and then it'll come better in a better form.
Okay, thank you.
Okay. No further business? Ms. Morgan?
Yeah. So two things. Tom Hayden contacted me. Apparently the News Press editorial board is entertaining the idea of having a meeting with our entire board in public to talk about the sales tax, wherein we would be responding to questions only from the news press, not from the audience, but it would be open to the public. He is thinking September at perhaps at Dunbar High. I forget his rationale for Dunbar High, but that was his suggestion, probably because of the technology they would have available. Anyway, so I just said I would bring it up, throw it out, see what your reaction is. Obviously, it's not something we have to answer today, but if you want to throw a comment out there now, go for it.
I think it's a great idea.
Can we waive the rental fee?
Probably.
Good for you. Mrs. Patrica?
I think it could be very interesting. I would like to participate.
Okay. Yeah, okay, all right. Second, FSBA has their Board of Director elections at the upcoming meeting. District 26, which is Lee County, is scheduled to elect their member of the board. It's a 2-year stint. I thought it would make sense, since we're the only district in that district, to go ahead and have that conversation now rather than try to have it on the floor when it's scheduled during the meeting. So I think everybody is familiar with the Board of Directors and has attended a meeting or so. So I'd like to have a discussion or see if there's interest on the part of anybody to, do it. Ms. Patrica.
I would like to do it because I'm thinking about getting involved in the leadership of FSBA, like maybe putting my name in the hat for treasurer next year. So I think that might be a good first step toward that.
I would support that.
I finished 2 years of that. There are occasionally extra meetings that will need to be traveled to, but it's a great, and then we would, best idea to have an alternate.
Yes, yeah.
Too, that would, so anyone.
Any volunteers for alternate?
Considering that it's a 2-year term, and maybe someone who's sure they'll be here for 2 years would want to volunteer.
I'll volunteer for alternate.
Ms. Giovanelli's volunteer for alternate.
Okay, all right. And now you may.
Now we can adjourn. And we will see you all back here at.
Oh, yeah, that's.
We need to be here a little bit before. Is this the meeting we come a little bit before for?
No, that's.
Next one.
Next one.
Okay, so we'll see you back here at 6 o'clock.
Thank you.